I'm Ekaterina and I'm here to teach you how to release low back pain with instant results. Any low back pain. It works like magic. From now on, you won't have any problems to treat your patients. I will show you now how I treat low back pain and how Dr. Tan taught us. The first question that you ask the patient, where is your pain? And the patient shows where the pain is using his finger. When you are certain about the location, you must find the exact area of pain. Why do we need the exact pain location? Actually, we must detect the meridian that goes through the painful area. And if we detect the meridian, we can build out the treatment. The method that I'm going to teach you today will work for the pain which is above lumbar 4 or 5. So anything below that will be another approach. And the question that you ask your patient is, which side is more painful? According to balance method, we mainly needle the opposite side. If the pain is on the right hand side, we treat the left arm in this case, but if the pain is on the left hand side, we will treat the right arm or the right leg. This is the general rule. So for this condition, we suggest to apply the lingo combination. Lingo is the famous combination which came from Master Tong teachings, and it includes 4 points, and number 1 is lingo. Lingo, we also call it large intestine 4.5, which is halfway between large intestine 4 and large intestine 5, and you can reach it in the very corner between metacarpals. When you needle this point, you needle slightly towards the wrist. The next point is dabai. How to needle dabai and how to find the dabai point. In some books you will find a dabai is the same as large intestine 3, which is not correct in our case. Dabai is located half soon or 0.3 soon lower than large intestine 3 towards large intestine 4. So if large intestine 3 is on here, we go slightly lower and dabai will be here. We needle it until we reach the Durchi. The next point is zongbai. In some books, it says that this point is the same as San Jiao 3, which is not correct. Zongbai, in our case, in order to treat low back pain, will be slightly below San Jiao 3. So you needle it deep until you reach Durchi, and imagine that will be about 0.4, 0.5 soon. The fourth point is small intestine 4. When you insert these 4 needles, ask the patient, where is his pain now? The pain can be reduced from 5% up to 100%, but normally you can achieve 50% result after these 4 needles. Sometimes it's more, sometimes it's less. If the pain persists, you can include 2 more points, which are Yao Tong. We also call this combination belt. What is the belt? is when you put the needles on the basis of metacarpals across the wrist. Two points that located on the continuation of the middle finger is called Yao Tong. So you can add 2 Yao Tong points on the wrist on the opposite side. The pain will be subsided. What else can we do? According to the table with 6 systems, you will see that treating the bladder meridian, which is sick, we can needle small intestine according to system 1. We can needle lungs according to system 2. We can needle kidneys according to system 3. We can needle lungs according to system 4, which is Chinese clock, and small intestine, the system 5. So if we feel that we can do something else and the pain is still there, so the suggestion is to add some more points either on the lung meridian or kidney meridian. Where should we add these points? Let's imagine that we project our body onto our arm. So the upper part of the back will be the upper part of the arm. The elbow will coincide with the waist, and from the elbow to the wrist will represent the lower part of the body. So if you find Ashi points somewhat around lung 5 and needle them, that will subsidize the pain even lower. You can also use the same points on the kidney meridian, all Ashi. Ashi points down kidney 10. In balance method, when we say Ashi points, we mean not Ashi points on the painful place or on the back. We mean Ashi points which correspond to the painful place, but on the arm or on the leg, on the corresponding zone. Why? Why we don't needle the painful place using balance method, and why we achieve the instant results, not only in pain relief, but in healing this place. Because balance method works through the nervous system. So the nervous system picks up the signal of pain and works through the brain to release the blood into the painful area. When you apply the lingual combination, your patient in 90% will feel the warmth in the lower back, warmth coming back up the spine. What it means? It means that the blood starting circulate around the problematic area and the pain subsidized. So this is my main suggestion. This theoretical part will be followed by the practical treatment, so you will see the point locations and needling techniques, and you will see the whole treatment in the process. Boris suffered from low back pain during many years. He was a professional volleyball player, and his pain is on the left hand side. Okay, could you please stand up and show where your pain is? Could you please move this up? This area?
Yes.
Okay. So on the left hand side, on the level of lumbar 2. Please sit down. First of all, I will show you how to find the lingual point. Lingual point is at the end of the metacarpal, in the very corner. So we find this corner spot, a needle deeply on the opposite side towards the wrist. Please let me know when you feel pain, Boris. Say yes when you feel pain.
Okay.
Thank you. Dabei, we needle slightly lower than large intestine 3, approximately 0,405 soon. This is large intestine 3, and this is Dabei. Let me know when you feel it. Thank you. Zongbai, we needle slightly lower than Senjiao 3 towards the wrist. And small intestine 3, small intestine 4, we needle here.
I feel it.
If you want to use the belt, we can use 2 Yao Tong points, which are on the opposite side of middle finger. How is your pain now, Boris? Move your pelvis, move slightly in the chair.
It's not that sharp.
Is it slightly lower?
Yes.
Thank you. Where is your pain now? Show me, please.
The same, about the same here in this place.
Okay. So now we will choose acupoints on the lung meridian. On the left-hand side, on the same side, is this tender?
Yes.
Is this tender?
Yeah, it's more painful.
Okay. So the acupoint will exactly coincide with the painful points on the back. So we need a long 5. Thank you.
I feel it.
How is your pain now, Boris? Move your pelvis, please.
Yes, it's not entirely gone, but it's on the way. It's much better.
On the scale 0 to 10, how bad is your pain now?
It used to
8.
be 8, now it's 3, 4.
3, 4.
Thank
you. So sit down, please, for 40 minutes. I will come in 10 minutes and I will gently move the needles to reinforce the treatment.
Okay.
Hi, Boris. How are you?
Okay.
I will reinforce gently the needles. I will touch them, and whenever you feel any sensation, pain, just let me know. Say yes. Do you feel this one?
Yes.
This one?
Yeah.
This one?
Yes.
This one?
Yes.
This one?
Yes.
This one?
Yeah.
Thank you. 10 more minutes.
Okay.
Okay, Boris. Where is your pain now?
It's on the level of 1, I would say.
Now, I will put few needles on your leg. I choose kidney meridian to balance the bladder meridian. The pain is still on the waist, yes?
Yes.
Okay. Is this tender?
A bit.
Is this tender?
Yeah, it's a bit more.
Okay. Kidney 10?
Yes. Thank you.
How is your pain now, Boris? Move your back.
I would say it's almost gone.
Well done.
Almost. I'm still a bit uncomfortable, but it's almost gone.
30 more minutes, please,
Okay.
in this position.